I'm a high-risk labor postpartum nurse. This is kind of a neat thing to know about. It is called a nipple everter. If you've ever breastfed or pumped or would like to, this is not sponsored. It's just a cool thing I think you guys should know. Not all nipples are created the same. They come in different shapes, sizes, perfectly fine and normal. If you're going to be latching your baby at the breast, we'd like to get your nipple everted. That means this little tip at the end is poking out. When it is poking out like this, it can be easier for a baby to grab and latch onto the nipple. They can get a nice tight seal, get the milk out, remove it a little more efficiently. A lot of people, their anatomy just naturally is everted. Some people may have flat nipples. They kind of look like that. Some people, their nipples are inward like this at all times. If we have nipples that are flat or pressed inward, baby may just sort of slip off. It can be hard to get some of that tissue in their mouth and effectively remove the milk. Finding a way to evert the nipple, if possible, can be really, really helpful. I was at a conference in the summer and I came across this little gadget. It is called a nipple everter. Lancino makes it. I've never seen one before. If you have a flat or inverted nipple, this may be a way to help evert or pull out the nipple so that your baby can grab onto it a little more easily and hopefully remove the milk better. It's kind of like a bulb suction. We compress it, squeeze out the air, place it over the nipple as centered as possible in the middle. So we let go and it should pull the nipple out if the anatomy allows. I've never seen anything like this. At work, when I'm with patients who have flat or inverted nipples but need to be stimulated or need a little help, we have used hand breast pumps. I've heard of people who would use a medical syringe and pull the plunger out, cut off the end, and like you literally suck the nipple out with this medical syringe that they have jimmied. This is just cool. Not sponsored, anything. It's just a new gadget I had never seen and I think people should know about. What we really want to do is talk to a lactation consultant, as that's really where we're gonna have like an individualized plan with breastfeeding. But this is a great tool. It is definitely worth a shot. If you have inverted or flat nipples, you can bring up with your consultant or your team and see if it works for you. For more information on pregnancy, birth, postpartum babies, give me a follow, check out my page.